If you get shoulder pain when you raise your arm, or maybe when you're reaching for something or picking something up, I'm going to show you an exercise that can quickly get rid of it. So I'm going to show you the exercise first so you can try it, so you can feel and see that it works. Then I'm going to explain how often to work on the exercise, and then I'm going to finish by explaining why it works, because understanding why it works can be really important for keeping pain away long term. So we're going to start by assessing your shoulder to see how it moves and to see how it feels. Then we're going to do the exercise and reassess your shoulder to make sure that it works. Now there's different ways that we could assess the shoulder. You could do a range of motion assessment, so maybe I could raise my arm forwards, or I could raise my arm to the side, and I could see how far it goes and how much discomfort I get in different positions. You could maybe reach to a shelf that normally causes you problems, because if you reach up and it hurts, and then we do the exercise and you reach up and it feels better, then that's going to be a good indication. Or you could maybe do some kind of exercise like a shoulder press. So do the exercise, see what your range of motion is like, so how far your arm goes and in what position you get discomfort. Now that you've assessed your shoulder, I'm going to take you through the exercise. And what we're going to be doing is mobilizing the axillary nerve, which is a nerve that supplies some of your shoulder muscles. And when we're working on mobilizing nerves, we're going to be creating tension in them, and we only want to work on them gently. So we're thinking maybe a 2 or 3 out of 10 in terms of tension. We don't want to crank on it and create a really big stretch. So we're going to set up for the exercise by creating a neutral pelvic position. So I don't want you standing like this with your butt sticking out. I want you to have a neutral pelvis. Then you're going to glide your head back and just tuck your chin slightly. So you might feel just a little bit of a gentle stretch in the back of the neck there. So you're going to find that position. You're then going to bend the arm that you're working on. Obviously, if your left arm is the problem, shoulder, that's the side that you're going to work on. If it's the right side, then you work on the right side. So I'm going to gently bend my arm. Then I'm going to lower my shoulder blade. So this is lifting my shoulder blade. This is lowering my shoulder blade. And as you do that, you're going to start to pay attention and see if you can notice kind of a tugging, stretching motion on the outside of the shoulder here. So as I lower my shoulder blade, I can feel it a little bit. But then what I'm going to do is I'm going to tilt my head away. And now as I do this, I now start to feel that kind of 2 or 3 out of 10 in terms of tension in my shoulder. So find the tension first by going through that sequence: pelvis, neck, bending the arm, gently lowering the shoulder blade, and then tilting the head away. Now what I'm going to do is mobilize this nerve at a few different joints. So I'm going to start by mobilizing with the head and neck. So as I bring my head into this position, it takes the tension off. I'm then going to tilt my head and it increases the tension. I'm going to do that 4 or 5 times and then relax. Then I'm going to go back into that position. So I found my tension again. And now I'm just going to gently lift and lower the shoulder blade 4 or 5 times. So each time I lift the shoulder blade, the tension comes off. Each time I lower it, I feel the tension. So lift and lower, lift and lower. And then again, I'm going to relax. And then we're going to do one final mobilization. So I'm going to find my position again. So I've got that 2 out of 3 tension on the outside of the shoulder. And now I'm just going to externally rotate and internally rotate my shoulder like this. I'm going to do that 4 or 5 times. And as I do this motion, it takes the tension off. As I go back into this position, it increases the tension. So I'm going to do that 4 or 5 times and then relax. So now that you've done the nerve mobilization, you're going to reassess your shoulder to see how it moves and to see how it feels. And when you do this, it's really important to do exactly the same thing that you did the first time. So if when I was testing my shoulder like this, I just raised it up at this speed and I got a certain level of discomfort, maybe when I got to that point, you're going to do the same thing. Or you're going to monitor, does it go the same distance but it feels better? Does it go further? What sort of changes happened? But it's really important that you test it in the same way. I find when people have been in pain for a long time, they're so used to pain, they try and find a way to make it happen. So maybe the first time they raise the shoulder and then it's uncomfortable. The second time they go to the same position, it's not comfortable. So then they try and force it and they do different things with their shoulder to make it hurt. So don't do that. Try and do a fair assessment, raise it, or do the exact same movement that you did before. And if it improves, Awesome, we have found an exercise that you can use to quickly reduce your shoulder pain and improve how it functions. If you got a good response from that, leave me a comment down in the comment section and let me know. And now let's talk about how often to work on the exercise. Now, if you do it when your shoulder hurts and it gets rid of the pain, that's awesome. But what I recommend is that you work on it multiple times per day, at least for a few days. So thinking between 5 and 10 times per day. And the reason that you want to do it frequently is because that's how your brain learns. If we do something once, the brain doesn't learn that much, but by doing it multiple times, it helps to retrain the brain. And often within a few days, within a week, that can be enough to completely get rid of shoulder pain in a lot of people. Now, 5 to 10 times can sound a little bit scary, but it really only takes 30 to 60 seconds once you know what you're doing. So it's just finding a way to remember. And often you can just add it to something else that you're doing. So maybe each time you go to the bathroom, before you leave the bathroom, you just do this shoulder nerve mobilization, and that could squeeze in 5 to 10 times, and that's all you need to do. Other people like to set an alarm. There's no right or wrong way, but working on it frequently is going to give you the best possible results. So now that you understand how to use the exercise, I want to quickly explain why the exercise works, because research shows time and time again that when people understand how pain works, it helps them to get rid of it more quickly and it helps them to keep it away. Now, pain is very different to what most people think it is. Pain and injury are not the same thing. Pain is actually a protective mechanism created by your brain because of perceived threat and perceived danger. So your brain is basically trying to warn you about stuff, but it might not be warning you about the things that you think it's warning you about. Because most people, when they've got shoulder pain, they think it's because of some kind of rotator cuff injury or something like that. But the research is very clear that that's not the case. You can have agonizing pain without any injuries to underlying tissues, but also if they were to run MRIs on 100 people that are completely pain-free, they would find 60 to 70% of them have a rotator cuff tear, but they're completely pain-free. So pain works very differently to how most people think, and that's awesome because it means there's normally a way to get rid of it. So we have just worked on addressing one potential underlying cause. We have worked on mobilizing a nerve, because if nerves don't move freely, that means our brain can't send information to the muscles as efficiently as it should do, and it can't receive sensory information back from the muscles in the body as efficiently as it should do. And that can be an underlying source of threat for your brain. So then when we mobilize the nerve, it can solve that problem. So this exercise can get rid of pain for a lot of people. But if it doesn't work, that's okay. There are lots of other potential underlying causes of threat. And the reason I'm explaining this to you is because there's nothing worse than when someone says, this is going to get rid of your pain, and it doesn't, and then you're like, oh no, what do I do now? How do I get rid of my pain? Well, that's okay. It works a lot of the time, but people have different underlying problems. So it's just a case of finding whatever underlying problem might be going on and working towards addressing that. So if that's something you'd like help with, I've got a program where I teach people how to address all the underlying causes of pain. I'll leave a link to it down in the description so that you can learn more if you're interested. If you've got any questions about what I've talked about here, leave me that down in the comment section and I'll try and reply as quickly as I can. And lastly, if you found this video beneficial, if you give me a thumbs up, it really helps me out. And also, if you could subscribe to my channel. Depending when you're watching this, this is a new channel and I want to grow it as quickly as I can to get this information to as many people as possible, because there's a lot of people struggling with pain. I dealt with pain for most of my younger life and it's horrible, so I want to help as many people as possible. So if you could subscribe to my channel and also share this with any friends or family members that you feel would benefit, that would be greatly appreciated as well. Okay, thanks for watching. I'll catch you next time.